Hey people, welcome back to the channel. So the topic that we'll be covering up today is the subclavian artery. So let's consider this as the arch of aorta and these are its branches. So this is the left subclavian artery. The middle one was the common carotid artery, left one, and this one is the brachiocephalic artery, which is divided into two branches, the right common carotid and the right subclavian artery. Now let's mark this as the arch of aorta, and the main question that comes on the subclavian artery is to enumerate its branches. Enumerate the branches of the subclavian artery. Now subclavian artery is divided into three parts by the scalenus anterior muscle. This scalenus anterior muscle is the most important. It is divided into three parts by the scalenus anterior muscle. The first part is from the origin to medial border of the scalenus anterior muscle. So in this figure, here is the subclavian artery, and the first part is from the origin to the medial border of the scalenus anterior. Now the second part lies behind the scalenus anterior muscle. It is behind the scalenus anterior muscle, and the third part is from the lateral border of the scalenus muscle to the outer border of the first rib. It is from the lateral border of the scalenus muscle to outer border of the first rib. Ab idhar the second part is behind the muscle and the third part is from the lateral border of the scalenus muscle to the outer border of the first rib. एंड द मोस्ट इम्पॉर्टेंट, जैसे ही ये फर्स्ट रिब के आउटर बॉर्डर से बाहर निकलती है, इट कंटिन्यूज एज द एक्सिलरी आर्टरी. इट कंटिन्यूज एज एक्सिलरी आर्टरी एट द आउटर बॉर्डर ऑफ द फर्स्ट रिब. जंपिंग ऑन टू इट्स ब्रांचेस, फर्स्ट पार्ट के तीन ब्रांचेस है. इट इज़ द वर्टिब्रल आर्टरी, द इंटरनल थोरैसिक एंड द थायरोसर्वाइकल ट्रंक. अब सेकेंड पार्ट का हमारे पास एक ही ब्रांच है, द कोस्टोसर्वाइकल, एंड थर्ड पार्ट का डॉर्सल स्कैपुलर. कमिंग ऑन टू द बेस्ट पार्ट, द निमोनिक्स फॉर द सबक्लेवियन आर्टरी. निमोनिक है इसका विटामिन सी डी. वी से वर्टिब्रल आर्टरी, आई से इंटरनल थोरैसिक आर्टरीज, and T for thyrocervical trunk. C से we have costocervical trunk, and D for we have the dorsal scapular artery. Now this VIT or the vitamin part is from the first part, and the C costocervical trunk is from the second part, and the dorsal scapular is from the third part of the subclavian artery. So the mnemonic is vitamin C D.